Hello everyone. Interpreting in public sector. In some countries, interpreting in public sector is provided by the state. And in cases of emergency, you will be supported by a professional interpreter. In these countries, interpreters in public sector are trained and certified. And this kind of interpreting is a profession which fulfills a noble mission. In other countries, interpreting in public sector does not exist. And you have to deal yourself in any cases of emergency, left helpless, with no chances to explain whatever is vital at the moment and to understand what you are told. Sure, if you are lucky to be somewhere where there is your country's consulate or diaspora, you can turn to them. It is clear that the professional activities of interpreters in public sector are directed to assisting non-citizens, aliens. That is why educating interpreters and paying them salaries may seem as a waste of money, which is not reasonable. That is why a question arises about the countries which do provide interpreting in public sectors and through this provide care and support for experts, refugees and all kinds of foreigners. Why do they do it? Speaking of a training course of interpreting in public sector, we need to identify the main sectors of social life where the help of an interpreter can be useful, so that we can identify the typical life situations and language material which needs to be taught, besides the necessary knowledge and professional qualifications. We know that any kind of judicial organization, citizens must be provided with an official interpreter. This is a hired employee who is on duty and is paid for the job. But what about healthcare organizations, educational organizations, public transport, and so on? When a foreigner appears in situations connected with these sectors, he or she sometimes is totally helpless, without any opportunity to be understood. Some situations may be urgent. So my idea today is to provide the list of spheres of public sector where using help of interpreter is in high demand. Healthcare, education, transport, what else?